Hey, good afternoon. Welcome once again to my page. You're welcome. So I'll be discussing shortly on medical jurisprudence and ethics. So I said that discussing on 200 level courses, and the first video was for fundamentals of nursing. So this one will be for medical jurisprudence and probably cell pathology. So I will know, okay, I'm sure with 200 level for the meantime. Majorly recommended topics and selected topics I feel as a nurse or as a year 2 nurse you should know, you should learn at this point in time. Okay, talking about jurisprudence or talking about ethics in nursing is nothing too much. It's majorly about the laws that are guiding this profession. The laws that are guiding the profession. So I said the laws that are guiding the profession, such as so I'll start by talking about ethics itself. So as a year 2 nurse that will be preparing for second semester, if that's how they run it in your school, you'll be studying NSC 212. I don't know if it's the same with your school. Talking about medical jurisprudence and ethics. So that particular course is talking about ethics, the laws, the morals, the guide, the profession, nursing. So you have to know the definition of nursing. What is nursing? What is nursing ethics? Yes. What is ethics on its own? Then what is nursing ethics? Then talk about the type of ethics. We have different type of ethics. We have applied ethics, bioethics. You have to know the type of ethics as well. We have ethical principles. This is very much important because you are literally going to see it till you graduate in nursing. Ethical principles, talking about the principle of autonomy, talking about the principle of veracity, talking about the principle of fidelity, talking about the principle of null maleficence. I think there are about 6 or 8 so you really need to know them, and you really need to be able to tell the difference between the two, because this same ethical principle will lead to what they call ethical dilemma, whereby you will be in a fix, as in you don't know what you should do. Let's assume a patient is how will I put it, an old patient, and probably this patient is not mentally stable or so, and then there is a place whereby you have to restrain the patient. So you are in a fix of, is either will you restrain this patient, and you are overriding this patient in the sense that the patient does not have an independent is not independent on his own. And autonomy is talking about independence, say, of a patient, when the patient can make they can make, how am I going to put it, they can make decision, yeah, that's it, they can make decision on their own. And then this patient particularly is a bit deranged, and you have to make decision for that person. So you are in a fix as to if you should follow the ethical principle of autonomy, or if you should follow the other way around. So you really need to know the principle, because the principle will guide you to be able to bring yourself out of every situation of dilemma. So that's it. We also have ethical theories. We have ethical models. So you really need to go check on that. I think we have theory of utilitarianism, something like that, whereby the majority is being considered more than the minority. Take a look, for example, a situation whereby we have an affected patient in a ward. So what are you going to do as a nurse? Are you going to go for the majority, or you focus on this person that has TB? So at that point of utilitarianism is telling you that the majority should be the one that you should go for, in the sense that you see how you are going to manage those majority to prevent them from being affected. So you find a way of isolating that man with TB and removing that man, or admitting that man into the ward, so that others will not be affected. So these are ethical cards, they are ethical codes, they are principles, they are theories that help us and prevent us from litigations. They help us to know our rights as a nurse and what we can do and what we cannot do. They help us to tell us our scope, yes, our scope, what you can do as a nurse, what you are not expected to do. So that's that. And also this will lead us to what they call ICN code of ethics, which is very important. There are important things you need to know in this jurisprudence: is ethics, ethical principle, ethical theories, ethical dilemma, ethical model, and ethical codes. Yes, code of ethics, very important. Of course, we have the International Code of Nursing, that's it. ICN give us I think, is it four? Yeah, four codes: nursing and the patient, nursing and the profession, nursing and the healthcare workers, you know. So they will tell you, okay, as a nurse, this is your responsibility to your patient, this is what you're expected to do. As a nurse, this is your responsibility to your profession. As a nurse, this is your responsibility to the nursing practice. And as a nurse, this is your responsibility among your colleagues and co-workers. So you really need to go study on that. Nurse and the patient, nurse and the profession, nurse and nursing practice, nurse and colleagues or co-workers. So that's what International Code of Ethics is all about, and you really need to know that, because those really carry mighty marks. So that's for ethics and morals. That's for ethics. Yes, there are ethical models, just the way I said it. I think is it cherish decision making model. We give you a pattern how to be able to identify your dilemma, what are the actions to take in such a time as that. So go read on that. And let's talk about laws. Just like I say, medical jurisprudence and ethics. Jurisprudence talking about law, medical law. So you're going to know what's the term law, what are the type of laws. We have criminal laws, we have civil laws. We have criminal law, we have civil laws, but the one that is really into us is civil laws, because that civil laws is divided into two, and that's where we have torts and contracts. But contract is not really, we are not really involved in that, but we are really involved in what they call torts, because tort is where most nurses have issues. It's a part of the law whereby we literally get sued or other stuff. So tort is divided into two. We have the intentional thoughts and we have the unintentional thoughts. Intentional thoughts is something like assault. On that thought, intentional thoughts, what we do intentionally that can harm a patient, like assault. Assault is like a threat. You need to know the difference between assault and battery. So we have assault, we have battery, we have defamation, we have false imprisonment. Yes, those are intentional thoughts. I'll come again: assault, battery, defamation, false imprisonment. So those are intentional thoughts, and you need to know the difference between assault and battery. Assault is a threat, probably a threat to, I'm going to slap you. It's just a threat. You have not slapped the person. It's an assault. It's a threat to slap, a threat to harm, a threat to injure the patient or the client. So that's an assault. This person have assaulted me. Not that the person have slapped you, but the person is threatening to slap you. Like in the case of a woman who is in labor, if you not open your lap now, I go flog you. That's it. That's an assault. The patient can sue you for assault, that you are trying to slap her or hit her. So that's assault. Then battery is when it's no more a threat, you are carrying out that action itself. You are literally assaulting. No, let me not put it. You're actually hitting that person, slapping that person. That's battery. Now you are no more saying I go slap you, you're already slapping. No, you're no more saying I will eat you, you're already eating the person. So that's battery. So they can sue for assault or they sue for what? For battery. Then defamation. Defamation is when someone is saying a bad thing against you when it's not true. It's divided into libel and slander. So you really need to know the difference between libel and slander. Defamation also is common. Then we have false imprisonment, when we are holding a patient down, like use of restraint sometimes can be a false imprisonment. The patient is stable, the patient is okay, or you apply a restraint to a patient without their consent. The person can sue you for false imprisonment. So this is that. And intentional thoughts. Intentional thoughts, I've said that. Then unintentional thoughts. Okay, yes, under intentional thoughts we also have invasion of privacy. So there are 5: assault, battery, defamation, false imprisonment, invasion of privacy. You do not give your patient privacy. Just that's why I said this thoughts is very important, because now there they own nurses easily. Like, you want to carry out a procedure, you do not cover your patient. Patient can sue you for invading privacy. Or you want to paper, the patient is in a ward, probably in a closed area, you want to enter, you do not knock. Patient will sue you for privacy. So invasion of privacy is another intentional thought. Then we have unintentional thoughts. Unintentional thoughts is when we talk about malpractice and negligence. Oh, that part is very, very important. Malpractice and negligence. Malpractice and negligence. And I also talk about defamation. About I said there's libel and there's slander. You really need to know the two. Should I just give you the expo? So when you talk about libel, you're talking about the person is saying bad thing against you, which is not true, in writing, or in a newspaper, or in a newspaper, in the news, or in this also nurse, or this also patient is bad, is blah 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 like that, which is not true. The person can sue you for what? For libel. That's writing. You wrote it out. Then if it's slander is verbally. Orally, you are telling the patient what the patient is not. Patient, you are mad, or something is wrong with your head, and something is not wrong with my head. I will sue you. I'll sue you because you are saying what is not. So that's that. So you should be able to know that. Then talking about unintentional thoughts, we have negligence and malpractice. Negligence and malpractice. Negligence and malpractice. That part is very common, because negligence and malpractice. Malpractice in the sense that negligence in the sense that probably you forgot to do what you ought to do, like you, let's say you underdo what you expected to do in a situation whereby you have to give a medication, and you omitted something very important, and which can put a patient to harm. You are negligent. You are negligent about your work. Then malpractice is when you do not do you did not do well. I don't know how to be able to, but then you have to know the difference between malpractice and negligence. You have to know when what this person does is negligence and what this person does is malpractice. Malpractice is doing something that is not in your jurisdiction. Yes, you are doing something that is not in your jurisdiction. You are doing, I don't want to put more than what I expected, because it's not right. What I do is not even right. So that's, they can hold you responsible. Malpractice, you know what to do, but you are not doing it well. Like now, you just go and invade someone's privacy. Are you going to tell me you don't know that you're not supposed to invade somebody's privacy? So the person can, that's malpractice. You are not doing as expected. You really need to know the difference between those two. So let me give some quite examples of just the way I said negligence. Like an example of negligence is you omitted a medication dosage, or yes, probably you're supposed to give um, um, 10 milligram, then you find yourself giving 1 milligram. I forgot. No, and let's assume you even give 50 milligram. Oh, I did not know. That's negligence on your part. Like, it falls beyond your expectation, it falls beyond what is expected of you as a nurse. The patient can sue, because leave that in harm the patient. That's an overdosage, and you can be sued for that. Then malpractice is, you know what to do as a nurse to me. Yes, you owe a duty to me, but I failed to carry it out. And then the patient was okay. There is a situation like that, like this. Okay, we know what to do as to, you are supposed to check your vitals. You're supposed to check my vitals rather at the point in, but like, this patient looks stable. There's no need of checking the vitals. This patient looks stable. And for eventually, I was going out of the place. I just realized that I fell, and at that point in time, my blood pressure was critically low. And then you were a nurse, they ask you, how far? You do not check this person when this person came. I don't know if you get it. You do not check this person when this person came. Oh, I'm sorry. It escaped my mind. What? That's malpractice. Like, you were literally supposed to carry out this duty on me, but you failed to carry it out. And because you failed to carry it out, you could not dictate that my BP was really low, and I fell, and I had hypotension, which nearly could cause harm, or could really make me just park and go like that. So that particular nurse can be sued for what? For malpractice. You know the duty, you know your duty, you do not carry out your duty as expected, then that's a malpractice. The negligence is probably you forgot to carry out. There's a difference. I don't know if you're trying to get the difference. So there is okay, let's assume somebody that want to sterilize an equipment now or something, but you do not check if the or say you want to suction, you not check if the suction machine is working very well or not, and then you started using it on the patient, and the patient started having I started having bruises, probably because the tubes were not okay. So that's negligence on your part, because you did not check very well. It's different from you check, you overlook, and you continue. So that's my practice. So you really need to know the difference. If I don't know if barrister is teaching you, barrister really love that part. Difference between negligence. One is intentional, one is an intentional, unintentional thought. One is unintentional thought. So you need to know that. Then let me check what again do you really need to know in jurisprudence. Just jotted them out so I will not forget. Then the criminal part is demo and felony. I said there are two types of laws, criminal laws and civil laws. Then under civil laws is when I talk about thoughts. Then under criminal laws is where I talk about misdemo and felony. Misdemo is just like little crimes. They're just small crimes. They are not really that bad. They're felony are big crimes, like armed robbery, all those kind of manslaughter. Those are big crimes. Assault, battery, fraud, they are big crimes. So that's different. Misdemo, they are little crimes. Then felony, they are big crimes. So I also need to know what must be in place before a nurse can be liable. What must be in place before a nurse can be sued? There must be a breach of duty. No, there must be a duty itself. What is expected to carry out that is not carried out? There must be a duty itself. Then there must be a breach of duty, in the sense that there must be an evidence. Okay, there was a breach of duty. Okay, this nurse did not carry out the duty as expected. Then there must be a proximate cause. Proximate cause, in the sense that so the breach of duty is more or less like that's the cause. That's what actually caused the injury. So there must be a duty, there must be a breach, then there must be a breach of the a proximate cause, and then the damage. So those four things is what will make someone liable. Those are proof of liability that okay, you can sue this person. So that's that about that. If I tend to remember more, I will still let us know. So that's that for medical jurisprudence. If I remember any other thing, okay, yeah, I remember one very important one. Consent. Very, very important. Consent. Talking about consent is talking about informed consent. Taking a go ahead from your patient before you do anything, before you carry out any procedure at all. You must inform your consent. Before you do anything, you must inform your patient that please, can I go ahead? I want to do this, I want to do that. So my assignment for you is go with more concept type of consent. Yes, we have verbal consent, we have written consent. So you really need to go study that, and you really need to go know those exceptions for consent. Like if you're a mentally deranged person, it's not easy to carry out a consent. And if you're unconscious, it might not be easy. So you really need to go and know the exceptions and what to do when you find yourself in that type of situations. And also talking about consent, you need to know what are the things that you are to explain to the patient, the risk, the advantage, the disadvantage, the prognosis. So you need to explain when you explain to that patient that is going for surgery now. You cannot just say to the patient, I want to do surgery, should we go ahead? No, you must tell the patient what the surgery is all about, what is the reason, do you have alternatives, what are the advantages, what are the disadvantages, if I not do the surgery, what will happen to me, if I do the surgery, what will happen. If you need to tell me before I will be able to say okay, yes, you need to give me a candid and detailed information. So that's what consent is all about. Yeah, very important. So I'll just give you a summary. I said talking about jurisprudence and ethics, we talk about ethics, talk about type of ethics, ethical principles, ethical dilemmas, ethical models, ethical theories, etc. Then talk about laws. We say laws are divided into two: criminal laws, civil laws. Under criminal laws, we have misdemeanor and felony. Under civil laws, we have torts and contracts. We don't really have much about. Contract is just talking about the nurse to patient relationships, communication, and all. Then contract is telling you that you are not supposed to collect gifts from the patients, all those things, blah 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 blah. But thoughts is when you have intentional thoughts, unintentional thoughts. And I give you an example of intentional thoughts. Intentional thoughts, we have assault, battery, we have false imprisonment, we have invasion of privacy, then we have defamation, then unintentional thought, we have negligence and malpractice. So that's that. Then I talk about consent, type of consent, what are the informations that are supposed to be in the consent, and that's it. So that's that for medical jurisprudence and ethics. So let's talk about cell pathology. Cell pathology, that's NSC 213. Cell pathology. Nothing much, because I don't really know to say that much. But I remember that during cell pathology, you talk about cell, definition of cell, characteristics of cell, yes, components of cell, and then now talk about cell injury. Yes, cell injury. There are two types of cell injury. We have reversible cell injury and irreversible cell injury. And reversible cell injury is when you talk about atrophy, hypertrophy, aplasia, like that. So you need to go and study cell injury. You need to go and study cell injury. And irreversible cell injury is when we talk about necrosis. So you need to go and study necrosis. Just study cell injury as a whole. So cell injury is very paramount to cell pathology, because that's the basis. Under cell pathology, you also talk about inflammation. What is inflammations? What are the signs and symptoms of inflammation? Whereby I talk about redness of the skin, you talk about swelling, you talk about pain. So you really need to go talk about under cell pathology. We talk about cell injury, talk about inflammation. Then we also talk about hypersensitivity. talk about autoimmune diseases, talk about chromosomal disorders. So those are under cell pathology, which I would really appreciate you go to the library, check out the library, study it, and if I have time, I might talk about inflammation, because that inflammation part is really necessary, because it's that inflammation that actually results to all those med surge that we are studying in 300 level inflammation process. So that's it. If you have any questions, comments on the page, thank you for listening. Thank you for staying tuned. God bless you.